Today I'm going to talk to you about how to recognize and treat serious problems with grief. Grief is a normal, healthy emotion in response to a loss. In the military, the loss is very often traumatic and dramatic. I'll give you one quick example. A soldier was ordered to clear a building. He pushed open the door and went inside. A man was fully dressed in the Arab garb, and he could see his face and his blue eyes sparkling, and the man was holding a AK-47 pointing at him. The soldier immediately shot the enemy, and he fell to his death. He cleared the room and went on to the next building. This happened 5 years ago, and very often he has the picture of the man in his mind, and he repeats to himself, I never want to have that feeling again. I never want to have that feeling again. He tries to avoid having any thoughts about it. Anytime there's a trigger that reminds him of it, like a television show or hearing a weapon fired, he thinks about it. Sometimes his mood goes down and stays down for several days. This is an example of persistent pathological grief. The best way to treat this is either an individual or group therapy where the soldier directly revisits every detail of that incident, reminds himself that he was under orders in the military to destroy the enemy, and he did what he was ordered to do, even though taking the life of another human being is something that is quite unusual and long-lasting in its effects on a human being born and raised in this country. Pathological grief can take many forms. It may not necessarily be a remembrance of that particular incident, but it can be a kind of a numbness or dullness of your feelings, a general withdrawing and avoidance of all behavior, and not feeling anything but anger, rage, and wanting to be left alone. Pathological grief can have an adverse effect on one's physical health and may be associated with early death for complicated causes that yet to be demonstrated scientifically. The best way to deal with these problems, first of all, is to recognize the symptoms. The symptoms then can be either specific memories of the loss of an enemy that you killed, or the loss of friends killed by an enemy, or by a feeling of responsibility that you have regarding the loss of someone, even someone in your family. It could be the death or injury of a child in a car accident, or problems at home or at work in which someone was injured or seriously upset about your behavior. Every loss is associated with a sense of grief, and simply making believe that that grief is no longer present is not the answer to the problem. A soldier may well ask, how do I know if I have pathological or delayed grief? And the best answer is whether or not you can remember that lost person with less pain. The whole purpose of the grieving process is to integrate that person into your normal autobiographical self so that you can remember them without feeling tremendous unbearable guilt, tremendous sense of loss, or even a tremendous denial that that loss has occurred. If you're finding out that you can't have much fun, that you're not enjoying anything, that you may be drinking to excess, let me suggest to you that the problem may be an unrecognized state of persistent or pathological grief. It can be treated. Sometimes antidepressant medication may help. The worst thing one can do is to drink excessively or to use drugs. This will not help the problem. Another problem, perhaps even as bad, is avoiding anything that's related to it. Some people say, I don't want to go there. I don't want to talk about that. It's going to upset me for days if I start talking about this situation, this loss. Let me assure you that being upset for days is nothing compared to being upset for years if you don't address this problem. So then a brief summary. Every loss is followed by grief. Every grief has to run its course. The course is often complicated. You deal with it most effectively by talking to someone you trust who is trained in the field of dealing with grief, especially military grief, and you're in a profession that is often associated with situations that require grief. Talk to your provider, come in for help, and don't give up until you get treatment.